Good morning, President Herr. I appreciate your taking the time to hear why I believe that we must continue to expand the definition of primary care service providers to include physical therapists. My name is Lior Shalom, and I'm a doctor of physical therapy student at the University of Vermont. As our healthcare system is currently working, we rightfully consider physicians, nurse practitioners, and physician assistants as primary care providers. By elevating the physical therapy profession to that same status as those professions just mentioned, we can effectively streamline the care of our patients. I'd like to briefly mention what a primary care provider is. According to the Medicine Division of the National Academies of Science, Engineering, and Medicine in 1994, they defined primary care as the profession of integrated accessible healthcare services by clinicians who are accountable for addressing a large majority of personal healthcare needs, developing a sustained partnership with patients, and practicing within the context of family and community. If and when we include physical therapists in the conversation of primary care service providers, we can amend this definition to say that there are clinicians who are accountable and address all personal healthcare services. I do recognize that there has been a shift across the U.S. recently, which has allowed some PTs to step into these primary care roles. One such example that I'd like to bring up to your attention that has been very successful is in the U.S. military. The U.S. military follows a capabilities model in respect to their healthcare. Teams of physicians, nurse practitioners, physician assistants, physical therapists, and mental health specialists work hand in hand with each other to provide a successful treatment for the individual military personnel based on what they need. In these primary care team settings, it's imperative to have cohesion between the professionals. An ideal team will effectively pull from the strengths of its individual parts, and that is all we want, a seat at the table of primary care providers. The unfortunate truth is that there are barriers in place in the form of health policy that prevent these team efforts from taking place in the healthcare system outside of the military. We, as doctors of physical therapy, have a skill set that will only complement the rest of the primary care providers. Our goal is not to replace those other services, but rather have the opportunity to educate the public and the other professionals when they could, but most importantly should, see us. We are musculoskeletal professionals, and our goal is to use our skills to provide primary healthcare at a low cost, with a low risk, and in an effective way. Many of the common medical conditions that bring individuals to general practitioners can effectively be treated by PTs, one glaring example being back pain, which according to information presented by Georgetown University that pulls statistics from the National Health Interview Survey, affects over 8% of all adults in the U.S. The U.S. Census Bureau, as of 2020, says that there are over 250 million adults in the U.S., 8% of that being roughly 20 million. This same survey highlights one major point. About 83% of said adults with back pain use prescription drugs to alleviate the pain, with only 8% turning to physical therapists. I just want to highlight that number one more time. Only 8% of adults with back pain turn to physical therapists. Back pain is just one of the many ailments that I truly believe PTs would treat best, but we must recognize the other ailments where we are not the best fit. This is where the concept of triage comes into play. PTs are very aware of our scope of practice, and as mentioned earlier, we want a seat at the table of primary care providers. If the goal is to foster that team I mentioned earlier, then it's crucial that we all have the awareness to recognize where certain providers would make the biggest differences for our patients. There is a gap in primary care that physical therapists are the best fit to fill, and I recognize that it will take time and work. Talking to you, the president of the APTA, about it is the work, and now is the time for our profession to be respected and viewed as primary care service providers. Thank you again for your time, President Herr, and I look forward to hearing from you.